Hi, I'm Linda, creator of information about arthritis. If you are new to this channel, then don't forget to subscribe. Just click the subscribe button below and then click the notification bell to receive notifications of new videos when they are released. Also, don't forget to visit my website, Food with Arthritis, where you can find out more about these terrible diseases and download free articles. Facet arthropathy, or FA, is a very painful facet joint disease. The facet joint is the spinal cord and helps you to bend, twist and align the spine. The spinal cord has nerves that come off between the vertebra and the facet joints. At the front of the vertebra, there is a spongy disc, and at the back, the two facet joints rest over the facet joint below. When you get facet arthropathy, the cartilage between the two joints breaks down and gets damaged. The cause of this could be osteoarthritis, which is a degenerative disease, and is mainly in the weight-bearing joints, such as the spine, knees and hips, and attacks the aging population, as it is wearing away the facet joints, leaving the elder to stoop forward, and their height will begin to deteriorate. Another type of aging is the synovial cyst. This is a sac filled with fluid that could develop in the spine. Suppose you have an injury or an accident. This could be a sports injury or a car accident. The accident or injury could lead to facet arthropathy, especially if you land on your hip, back or knees. The main symptom of facet arthropathy is painful back and neck when you bend or lean back, twist or lift objects incorrectly, or you may find that part of your neck or back is stiff and you are unable to move. Neck facet arthropathy. You could also get facet arthropathy in the neck, because the vertebrae are at the top of the spine, known as the cervical spine. There does not seem to have any risk factor of the cervical spine. A study showed no link between the cervical facet arthropathy and gender, age or body weight, or even strenuous actions like lifting, pulling or carrying. Lumbar facet arthropathy. The lumbar region is the small of your back where the back curves inwards. This part supports most of the body's weight, therefore, the vertebrae are more protruding over a larger area. The risk factor of the facet joints is in older people. Also, women are more likely to develop this than men. If you are African American, it is less likely that you will develop lumbar facet arthropathy, and if you are overweight, you are more likely to develop this. Also, you are prone to facet arthropathy if any family has a history of the disease. You should go to your doctor if you think you have this disease. They can diagnose it by doing an imaging test. This could be an X-ray, bone scan, CT scan or computerized tomography. Or you could have a MRI scan or magnetic resonance imaging. If you are diagnosed with facet arthropathy, the treatment will focus on relieving the pain and stiffness. They will prescribe you non-steroidal anti-inflammatory drugs. The doctor or surgeon could make an appointment with a physio. A physical therapist will help you with an exercise plan, especially for you. Or you could have an anesthetic injection. The injection is where you have an anesthetic directly into your spine. This is only done every 4 to 6 months. I have had this done, but it did not work after a while, because with my legs, not the same length, my lumbar region is wonky and I needed more, which they could not do. And finally, spine surgery is for severe patients. The procedure is known as spinal fusion. It's done by fusing the spinal bones that are affected together to make one bone. This helps to alleviate the pain by stopping the joint from moving. You can prevent yourself from getting facet arthropathy by doing the following: keeping your weight maintained. Do not get overweight, as this will increase the weight on the joints. Daily exercises are a must. Doing gently exercises daily like walking, swimming or light yoga will keep the joints moving. Injuries should be avoided. I know that accidents happen, but some can be avoided, such as wearing proper shoes when you do sport. Also, lift light objects from your knees and not bend over. You should keep a good posture. This means that you have a straight back whilst sitting at your desk, as well as standing and walking. Keep your back straight upright. If you smoke, you must stop. This causes harm to the bones and tissues around the joints. Eating a healthy diet is another prevention. This will help you to maintain a healthy weight. See my next video on diets after this. The conclusion is to prevent the development of facet arthropathy or any arthritic symptoms later in life. You should maintain a healthy weight, exercise daily, and wear the correct shoes for the sport or activity. Facet arthropathy or any other back pain is unfortunately incurable, but by following the expert's advice, such as your doctor, physio, or surgeon, and follow the treatment plan, your symptoms will reduce, and your lifestyle will become more active. I hope this video has helped, and don't forget to subscribe to my channel and receive notifications when new videos are released.